Okay. Mhm. All right. Well, so welcome. Welcome for you. Thank you so much for spending the time to join me tonight to talk about to join this webinar that we can talk about the programs that we offer here at Bastyr. Before I jump into it, let me introduce myself. My name is Angela Zeng, and I am the department chair for the acupuncture and East Asian medicine. I thought, I'm going to share a little bit about my journey with you, so that kind of give you a sense of, what's my involvement with the program. So, uh, prior coming here, I had my degree in physiology and commerce, and I have done 1 year of research assistant in the molecular biology lab before I moved to Seattle, and that's in 1996. If you count the years, ever since then, I have not really left here, not left Bastyr. So I changed my roles from being a student here and then became a resident and adjunct faculty and core faculty, and then now being a department chair. So I have seen the times that during this time how this field change and how our programs evolve. So that, really, really glad that you are here today to explore the options and possibilities. And, I'm really hoping that I can provide the information that you're looking for and learn about the program and to find out that whether this is a fit for you. And if you have any also like other questions that you have, I'm definitely willing to provide the resources and information that you're looking for. Okay, so let's see, place for that. Okay. So the reason to be an acupuncturist, um, definitely that, many of our students or the practitioners that our goal is like we wanted to uh, help our patients in their healing process, in their healing journey. In the meantime, at the same time, also helping our own. Treat diseases and health issues that can be physical issues or psycho-emotional, and also to provide the preventative care. And that's a one big aspect of it. As I share my journey with you, thinking starting at the beginning, wanting to be an acupuncturist, but again, shifting into education. Um, that's also another big part is, with not only just educating students, but the patients that we work with, it is also providing that information and empowerment so that our patient can take charge of their health. Provide additional ways to help manage pain. And I point this out because it is a big area, especially like during this time that talking about people's experience with pain and their experience um, with the different modalities that to treat pain and how acupuncture can play a really important role in that. The practice itself, as an acupuncturist, uh, one thing is that you can set how you wanted to practice. There are different settings where acupuncturists practice. For example, that private practice, a solo practice is still a big portions of it. And some of our grad, for example, having a family, younger family, and all their goal is to practice 2 days a week, right? Versus someone who has 3 different practice at 3 locations and hire other acupuncturists and other practitioners to join them. So there are different options and flexibility in practicing as an acupuncturist. And I do think that there is that growing demand of utilizing acupuncture. Um, so just give you I know this is in the past, like some students may have questions about. So May 2022, Bureau of Labor and Statistics occupational handbook actually has the average income median as 72,000 for an acupuncturist. But like I said, because of the different ways that people are practicing, and so the range can be quite big. Maybe even from like a 30K for being a part-time to 160K. And so the range is big for an acupuncturist. Okay. So at this time, we only offer the acupuncture program at the Washington Seattle campus. There are 3 entry programs that we offer, which is the Master of Acupuncture, Master of Acupuncture with a Chinese herbal medicine specialization, and Doctor of Acupuncture. These are entry programs, so that means that as long as you have your prerequisites, 3 years of college, then you can apply for these 3 programs. The other 2 programs are for people who already earned a degree. So Doctor of Acupuncture completion track is what we offer for practitioners who has a master degree and they wanted to upgrade to a doctor of acupuncture. So that's why we offer the completion track. Certificate in Chinese herbal medicine. So for example, that grads that earn their master of acupuncture degree and in their practice, or they are deciding to move a state that requires Chinese herbal medicine as a part of their licensing, and so that they come back and do the Chinese herbal medicine in order to obtain license. For example, California is a state that they only approve certain programs to be qualified to apply for licensure in California. So that is the certificate in Chinese herbal medicine. There are also our past students who split, like who decided to do the master acupuncture first and then do the Chinese herbal certificate later, so that the course load is a little bit less as they go through the program. These 2 together, so master of acupuncture on top, and then the bottom, this certificate in Chinese herbal medicine. If you put these 2 together, is master of acupuncture with a Chinese herbal medicine specialization. So it's more or less, there might be a few credits slightly different, but these 2 together equals to the master, to the 2nd degree. Anytime you have a questions, you can jump in to ask. Let's see, I don't think I'm able to see. Okay. All right. So let me talk about each of the programs. Sorry, I'm like blocking it, so I'll have to move a little bit. So Master of Acupuncture, this is a entry-level master program for those who wanted to practice acupuncture. If you are living in Washington State, for example, Washington State licensing, you do not need to have the herbal medicine as part of your scope. It is in our scope, but you don't need that in your education to obtain a license as an acupuncturist. So the entry requirement is a bachelor's degree or a minimum of 135 quarter credits, which is equivalent of 3 years of general education. And a minimum GPA of 2.75, a grade C or better in the prerequisite courses. This program is 3 years in length, and that's 11 quarters long. There is not a summer break. Our breaks are kind of between the quarters. So there is maybe a 1 week, 1 to 2 weeks break, kind of depends on the quarter. And then also in the winter time, it's a little bit longer during the holidays. The total number of quarter credits is 165.5 with 2,300 hours plus hours of didactic in-class hours and also clinical training. What this program prepares you is become an entry-level acupuncturist, ability to provide safe patient care. utilizing the modality within the acupuncture. So that's acupuncture. Some of you know about moxibustions, probably more aware of like cupping, and other adjunctive techniques. And these are the different things that we do cover in the program. Okay, and that's the Master of Acupuncture. The second program is the Master of Acupuncture with a Chinese Herbal Medicine specialization. And so, like I kind of mentioned earlier, in addition to all the curriculum that we mentioned previously with Master of Acupuncture, students in this program will also learn Chinese Herbal Medicine. So the curriculum, the length of the program is 12 quarters. So you're thinking, right? It's only 1 quarter additional in comparison to the Master of Acupuncture. However, each quarter, the credit load is a little bit higher starting from the summer quarter during the first year. So that the herbal medicine content is spread out starting from that summer all the way through to the 12th quarter. And so in comparison, each of the quarter is a higher credit loads, but the length of the program is only 1 quarter in addition. So total quarter credits would be 219.5, and with 3,100 plus hours of didactic and also clinical training. Clinical training, I think it's a little bit over 100, it's a little bit over 1,000 hours. That's including observation and also treating patients with acupuncture and also treating with herbal medicine. So very similar to the previous one, it is entry level. And you have all the contents as in the Master of Acupuncture, but in addition, you are able to prescribe herbal medicine in addition to the acupuncture treatments. Are we doing good?
I did actually want to ask, do you have to do continuing education as an acupuncturist?
Yes.
Okay.
So each state would have a different requirement, and Washington State adopted the similar requirement as our certification, and so that is 60 points for the 4-year time period.
Oh, okay. I see. So it's measured in points, and you just have to renew your license every 4 years?
So, no, it's not. So 60 points for 4 years, that's with the certification. And so the state actually is, you have to renew your license every year. But the requirement for the continuing education is every 2 years for 30 points. But they kind of do the total quantity the same, but then they want you to continue doing it. But reporting is every 2 years.
Okay, I understand. And then do you have to get relicensed in any state that you move to, or is it okay, I understand.
Yes, that's a very good question. If you are if you're considered doing telehealth for herbal medicine, for example, acupuncture is hard to do telehealth, right? So we can't really do the needles through the screen. But for doing telehealth, and also if you are considering doing multiple states, then you really have to look into to see what is their requirement, right? So before you choose the program, like what I have mentioned, Washington State you can obtain license with only a Master of Acupuncture without the herbs, but California, you will need the herbs in order to get licensed. And so if California is your consideration, then I would say don't consider the Master of Acupuncture, because
Right.
unless you complete the certificate afterwards, otherwise you will not be able to get through licensure. Not only that, California, both of your acupuncture and herbal training has to come from the same school.
Oh, wow. Okay. That is very good to know.
Yep, California, different testing, different They have a whole set of different rules compared to majority of the other states, which utilize one board for certification. So
Okay.
I can bring that information up towards the end when I can share my screen with websites so that that would be a place where you can explore.
Okay, great. Thank you.
1 second, let me just write it down. All right. The next one is the Doctor of Acupuncture. So again, this one is a again first professional doctorate. It is an entry-level doctoral program. If you have a look at other schools, you may encounter a program called DAOM, Doctor of Acupuncture and Oriental Medicine, and that is a different program. Okay, so I'm going to talk about the DAC first, and I'll point out the difference so that you have when you're looking for different programs, at least you're comparing the same ones. So this actually Doctor of Acupuncture, I believe the approval, the accreditation allowed the school to start offering the Doctor of Acupuncture probably in 2018. And then the school start to we wanted to upgrade the field, and so that's why schools are offering the Doctor of Acupuncture. It is the same entry requirement as the master level, and same entry requirement as you can see, but the program is longer, and it is a 4-year program. It's 14 quarters, so if you do math, it's 2 additional quarter to the Master of Acupuncture and Chinese Herbal Medicine. Okay. The additional competency that this program offers includes collaborations with other health care practitioners, and there is a component of more advanced skill sets in both acupuncture and also in the Western biomedicine. And so I would say those are the 3 areas where the additional coursework is focused on. There is a component of additional clinical training, and so what we offer those are still inpatient treating patients for the 176 hours of treating patients, and that can be done at Bastyr Center for Natural Health, or the option is to get that training in the hospital setting. So that is the difference in comparison to the master degree. Whether you are, and we ask our students that they need to be co-enrolled in the master program. Majority of the courses are the same, and the co-enroll is because some of the state requirement to obtain licensure at this time are still a master degree, and so we want to have our grad have the ability, even though they have a higher level degree, right, as a Doctor of Acupuncture, but if the state statute actually has the word Master of Acupuncture and you don't have the master degree, it makes it difficult to obtain licensure. And so students who are in the DAC also are co-enrolled in the master. So that's why you see the total credits and hour-wise for the DAC and MAC versus the DAC plus the MAC CHM. So this one prepares you to be a licensed acupuncturist in a private practice, just like the master degree will. But what it is also because of those competencies that's included in this program, with that focus of being in an integrative clinic, with collaboration with other practitioners. Right. So how is it different from a DAOM? DAOM is a advanced study degree, and when if you're looking at the other school that who offer DAOM, the requirement is the applicant needs to have an entry-level degree. So they would need to have a Master of Acupuncture or Master of Acupuncture with Herbal Medicine or a Doctor of Acupuncture. And that's a 2-year program. you would need to have the foundational training, then enter that, is because there's a specialty component for people who wanted to go into a particular area, whether it's a pain management or gynecology, and they also would need to do components of research as part of the requirement for that DA1. Okay. So the next two programs are for someone who already have a degree. So the Doctor of Acupuncture, students can enter this program either with a Master of Acupuncture, with or without the Chinese herbal medicine. And so it is a 2-quarter to upgrade their degree from a master level to a doctoral level. And so that expands the knowledge and skills and prepare the practitioner to collaborate with other healthcare provider. So that's a Doctor of Acupuncture completion track. And then the other one, which I mentioned earlier, it's a certificate in the Chinese herbal medicine. And so this is for grads who have a master degree in acupuncture, and then now they are moving to another state that requires Chinese herbal medicine, or that in their clinical practice they really see they wanted to incorporate the Chinese herbal medicine. It is a 9-quarter program, and it's part-time, so allow the students who can practice at the same time and still gain the knowledge and skill set in the Chinese herbal medicine to practice. So it is. It looks really long, 9 quarters, but it is part-time for this program. Prepared. I'm gonna put myself on so you can't see. Okay. So this is just a quick table that kind of shows what we have mentioned. Because these are all entry programs, they have the same admission requirement, and the differences between the Master Acupuncture and Chinese Herbal Medicine is that herbal medicine content, and then the difference between the master and doctorate in a sense is that additional of working with other practitioners, the skill set, the integrative care or the collaborative care. Let's see. If you think this is helpful, I can also have is minimized. Oh, so it's not, you can't really read it? Is that what?
Yes, actually, it looks as though your like where your image would be is the large screen instead of the chart being the large screen.
Oh, okay.
Maybe
Okay.
it, maybe
Yeah,
it needs to
yeah.
be
So
pinned. I'm not sure.
yeah, no, that's okay. So I think if you have you can't really read it, I would uh oh, okay. Thank you, Brooke, because Brooke is able to see the full screen. So I think it was actually I can if it's helpful, I can also have our admission and send you these information as well. So if this chart, I can have them send it out. So you have a copy.
Oh, thank you.
All right. Yeah, so I just wanted to kind of show you these are our core faculty. So in terms of our faculty, we have, including myself, we have 8 core faculty member, and our definition for core faculty is that these are our main instructors who participate, who teach in classroom settings and also in the clinic. And they're also involved in the curriculum designs and curriculum revisions. So there are eight of us, But in addition, we have additional adjunct faculty. We also utilize, we also have other core faculty member from other department. These are just within the department. We also have other core faculty from other departments or adjunct faculty in the classroom and also in the clinic. I think it's like 20 some faculty member that teaches in the program. And earlier I shared that I started at Bastyr as a student in '96, and here 1, 2, 3, 4. There are still 5 of my faculty are now my peer. They were my instructor, and so for me, Seattle is a really great place. And Bastyr for me is like one step I've never left. And part of it, not just the campus, but really is I really appreciate my faculty, that their dedication, their passion in teaching, and long term being here, that lineage and that effort, dedication to our student success. So it's definitely, people is definitely one of the reasons that have me stayed at Bastyr. So let's see. Yeah. So that is my kind of a discussion of the program. And if you have if you have not reached out, or I think you probably have the admissions information. But at this time, I'm gonna open it for any questions. If anyone has, and I'll also try to pull out those couple websites.
I got a question for you, Angela.
Yes, please.
I understand that a lot of the books used in the program, the students will purchase them their first year and use them throughout the whole program. Does Bastyr, do you have like a comprehensive list of these books? So if we, get accepted and decide to go to the program, we could get them ahead of time.
Yes. We do have a list, and I will include that as as a list to send out.
All right, thank you very much.
I actually also had another question about the doctorate of acupuncture program with the specialization in Chinese herbal medicine. So I didn't realize really the extensive difference between the doctorate and the master's program. Do you mind explaining a little bit more about being able to collaborate more interdisciplinary with other providers?
Yeah, so so let's put it this way, like for in the master's program, right?
Mhm.
And then again, a lot of the emphasis and focus is like really learning the medicine of the acupuncture, the skill set, the knowledge, and then or the herbal medicine part. And
Right.
so we do talk about, because for example, in our clinic, we have other modality, we offer different services, right? And so there are opportunities for students that collaborate with other practitioners within the Bastyr Center. And in the doctorate program is that we bring that out, and specifically to have other practitioners to come and discuss. So how can we better work with other practitioners? What I have found in a clinical setting, for example, from my private practice and also talking or working at the hospital, sometimes that we are the ones that help coordinate our patient's care. And we see our patient probably regularly and more frequent compared to them seeing their medical practitioner. And so I would be the one that looking at what kind of other therapies that they have, referring it or scheduling. So if they're having a chiropractic treatment, do I schedule it right after their chiropractic in order to help that adjustment help better, right? Or that I would prefer to go first to help them relax the muscle so they have it easier to do adjustments, right? So I think in that is carving out the time to students to hear different modality, and then just to see how that enhances how the awareness needs to be there. And I think it is an area that we need, and that more are being done. But I would say it's still pretty at the beginning, because I don't think there is a great way yet. So everybody is trying out different. So we are relying on these experiences to help push this forward. And who knows, maybe we can even change policy-wise, right? And so that is one component of the doctor of acupuncture, like better familiar with the biomedical languages in order to collaborate or talk to or managing the patient care.
That is a lot more than I thought was really involved in the practice at this moment, or within the acupuncture field. You mentioned being in the hospital. Do y'all practice inpatient?
Yeah, so I think earlier I did mention about the flexibility, because there are different type of practice. I would still say that a solo practice or a small practice of maybe couple practitioners, or now even bigger with a different like with a massage therapist, a chiropractor, and acupuncture, the collaborative kind of a practice. Definitely they are out there. Hospital setting, yes. They're gonna be more as an outpatient, as a contract-based outpatient. VA actually has acupuncturists as a job category. So I do think that it's not as the big opportunity in that sense, that many positions, but it is an area that acupuncturists are getting in. I would say even like 10 years ago, we had a student who was an anesthesiologist, and then complete the acupuncture program. And after she completed, she actually is able to just bring acupuncture into anesthesia, right? So because she's already in the hospital system, so that is a faster transition for them. So with Bastyr, we have our clinical training. The students actually have options to go to external sites, and currently we are with Neighbor Care, which is an outpatient community clinic that we provide acupuncture services in their clinic. We also have one with Providence Everett Oncology Center, and over there we treat mainly patients going through chemotherapy, and so it is in an outpatient setting, and those are options for students in any of the 3 entry programs. Specifically for the Doctor of Acupuncture students in their last quarter, which is that winter quarter, if they want, they have the options to have their clinical training at Harborview Medical Center, and that is an inpatient setting. It's in the pain and anesthesia department. The patients, may be there for a few days because of the injuries at Harborview before their surgery, or some patients even stay there for months or years. And so we are actually there providing services. So it is totally a different practice. To be able to work in the hospital, with the credentialing and then the limitations. And so it's a different practice, and there are students who are very interested in getting in, but there are also people like, that's just not my thing. I don't want to do that kind of a practice. So, but it's an option for students in the Doctor of Acupuncture.
Thank you so much for clearing that up for me.
You're welcome.
I think someone had their hand raised.
No, I think William says hello right from the beginning. Any other questions?
I did have one regarding the
Oh, Jessica, you would need to speak up a little bit. I can't quite hear.
sorry.
Uh-huh.
Yeah, I had one regarding credits. Because currently I am an acupuncture student, so I was wondering how many credits could be accepted, transferred into Bastyr.
Okay, transfer. Yeah, so with the transfer, with Bastyr is two-thirds of the curriculum needs to be done here, and then we do not transfer any of the clinical portion. So most often that I would say, if you complete like first year, the first year probably can be transferred except couple of our first year curriculum. And you will need to do an assessment for me to give you a better sense of like, what does that look like? Because I think different school, like every school is a little bit different how they deliver their curriculum. So we will need to do that. Do all of you know where to find our catalog? I'm gonna stop share this one first and switch to a couple things I wanted to share. Just in case that you be looking for it. Okay, so let's share screen one time. Okay, so this is our website, and so one way to get through our catalog is that you can go to programs and then academics, and then you will be able to get to the academic catalog. Okay, so program, academics, academic catalog. And then it's default to this year's catalog. On the left side, you can always do a search. I think Jessica asked about the transfer. If you put in as a transfer, you'll be able to pull the academic policy, which is also under here. But the School of Traditional World Medicine is where we are in, and then Department of Acupuncture and East Asian Medicine. And then there's a graduate program and then a doctorate program. So graduate program, if you're doing Master of Acupuncture, so you will be able to see the curriculum layout, which is here. Okay. And so the total credits information is down below. And total hours, the course total elective and the clinical portion add up to 2384.5 for the Master of Acupuncture. Oh, good. No, forgot that who asked about the licensure, but the other place, if you are planning to go to, there's a possibility for you to go to different states, mccaom.org. MCCAOM is our certification board, and they do have a regulatory tab, which can be helpful. So if you go to nccaom.org, under the regulatory, there's a state relations, okay, advocacy, regulatory, and then state relations. And what you have is you can look at the state licensure requirement map. And then you actually see them color coded. It's a little bit bigger, maybe. So Washington State, for example, the students would need to, there is the Acupuncture Practice Act, and then the student need to take the 3 board exams in order to obtain licensure. So as you can see, there's only one orange because California has California Acupuncture Board that offer their own exam. And so that's why they do have a practice act, but then they don't use NCCAOM. Another state, Oregon, for example, Oregon State, Chinese herbal medicine is not required. It's a 3, you have the 3 exams that's needed. Let's put a state that actually needs here. Florida, for example, you see the yes, 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 yes. So that means that, you know, you will need herbal medicine. If you click on the state, it will take you to the state's information. So it's a way of, if you're already thinking about, preparing for a possibility because your family is in one place and you want to eventually move to another state, it will be good to at least take a look of what the current state law requires, so that you choose the right program. Any questions? Hopefully that's helpful. Sometimes people don't think about it until later, which I understand, but I just thought, I have the opportunity, I'm gonna give it to you. Anything else? Particular information wise?
Once we submit the application, when would be getting an answer as to whether we're accepted into the program or not?
So once your application is in, our mission department will work with you, making sure that you have all the required components. For those of you who are still trying to like, for example, find the courses for the prerequisites, I would say you can also just ask our admission, or if you know a class, you can also check in with them and say, hey, does this one qualify for that particular subject or the number of credits. And then once everything is complete, then they will put, then they will have those information sent to the department and you can schedule an interview. And then the interview is conducted with our core faculty, which you have seen the pictures. It's probably gonna be 1 or 2 of them that to have an interview with you. I believe our admission department, once the interview is done, we try to get everything submitted. The faculty submit the information, and so that can get back to you within that week. Sometimes it gets a little bit delayed. Sometimes it's the faculty part that got delayed. But if you didn't hear anything, definitely check back in.
Thank you.
Okay. All right. If you do not have any other questions, thank you so much again for being here today. And I'm gonna type in my my email. If you wanted to schedule an individual meeting with me, I can respond back to you, and then I have a Calendly link where you can find a time that we can schedule for a meeting. I can help answer the individual questions. And what I'm gonna do is I'm also gonna stop the recording right now, but for those of you who wanted to stay, and if you have you feel like it's like, you know, your situation different from other people you want to ask, not on the recording, this will be your opportunity. So otherwise, thank you. Enjoy your evening.
Thank you.
Thank
Thank
you. Very nice to meet you.
Thank you.
Stop the recording.